Hi, all, good morning. So, today we are at another show in Cancer to Canwin. We have Dr. Manjula Rao with us. Good morning, doctor. Welcome you to the Cancer to Canwin talk show.
Good morning, Ashwini. Thank you so much. It's my pleasure entirely.
Yeah, thank you, doctor. Thank you. So, as we all know, this month being the Breast Cancer Awareness Month, we thought of bringing an expert oncologist to the talk show in order to bring us more awareness about breast cancer so that we'll be able to know what it is and how to detect it at the early stages, how to prevent, and how to cope up during the treatment. And so many things are going to be discussed in the next 40 to 45 minutes. So please do watch the show fully so that you would be able to be aware and as well spread the awareness as much as possible. So the statistics says like 1 in 8 women are being diagnosed with cancer in India, and it's also very common among the world. This is being the top most cancer in the world as well. So no matter what age this breast cancer is affecting many millions of women in the around the world. So a short introduction about Dr. Manjula, who is here with us. So Dr. Manjula, she is working in as a breast cancer specialist and oncoplastic surgeon at Apollo Proton Cancer Centre, Chennai. Dr. Manjula has more than 10 years of experience. She has lots of expertise in breast cancer surgery, treatments, and oncoplastic surgery, and all the other related treatments when it is coming to breast cancer. So we are going to discuss a lot and lots of stuff in this talk show. So let's get into the questions. So, doctor, my first question: why it is breast cancer, especially it is on rise in India among women?
So, breast cancer per se, in general, is a disease that has been on the rise. Over the last many years, the incidence has been increasing steadily. Initially, a lot of people thought that probably this was because the suddenly people are becoming aware. So, we're getting to know about a lot more cases of breast cancer. However, we do know that last year, even the World Health Organization announced that breast cancer is the commonest cancer in the whole world amongst both men and women, and was also the commonest cause of mortality. There is also data to suggest that it's not just increasing awareness, but that the incidence of breast cancer is increasing by 0.5% every year. This could be because of increasing, I won't just say westernization, but probably changing lifestyles where we're all, there's less sustainability and intake of a lot more processed foods and a lot of these things that sort of interfere with the hormonal balance of the body. So that's one hypothesis.
Okay, doctor. So, yeah, as you said, more and more Western culture is being introduced into our Indian traditional, and our Indian tradition is being lost slowly. So that would be the reason, probably. So thanks for that, doctor. And my next question: breast cancer, how it can be identified in the early stages?
uh, the commonest symptom of breast cancer is a painless lump. So the best way to actually, the gold standard to catch breast cancer early is a mammogram, right? So we call that process screening. What is screening? Screening is when certain tests are done to catch a disease before the symptoms have manifested themselves or before the symptoms are apparent. So, mammogram is the gold standard for breast cancer screening. However, not everyone can get a mammogram done. So, it's very age sensitive. We would recommend breast cancer screening in women starting from the age of 40 once a year. What about women before that? What about women who are younger than 40 years? Right? So, a very important something very important that we must include in our regular lifestyle as women is self breast examination. So all women from the age of 18 and above, they must get into the practice of examining themselves, getting to know their body and being mindful of any changes that may be there, be it in the form of a new lump, any skin changes, or anything of that sort. So, gold standard to catch breast cancer in the earliest stage is mammography in women from the age of 40 and above. And those less than that, self breast examination is what I would recommend. Every woman must do.
Okay, doctor. So when you were telling about self-examination, so what kind of examination should be done? Like once where lump, so where it generally occurs in the woman.
I'm sorry, I didn't catch that. I think there was an issue with the network. I didn't hear the question.
Okay, so you were telling about the painless lumps occurring in the woman, and that would be the first sign. So where it generally occurs in the woman, and how to self-examine.
So, since you've asked me this question, let me tell you the various symptoms that a breast cancer can show. The most common, of course, is a lump in the breast that is painless. It could also be a lump in the axilla. Axilla means the under area, right? Or a lump in the neck. It could be a lymph node, etc. The other signs to look out for are any skin changes, a dimpling, where the skin is pulled inside or puckered, changes in the skin texture, um, a little thickening, changes in color, the nipple and the darker portion surrounding it, the areola. There could be ulceration, there could be consistent itching in just the nipple and areola on one side of on one breast and not the other one, which is not healing despite the various creams that the dermatologist prescribes you. Then again, you must visit the oncologist or your doctor to ensure that it's not a cancer. Another sign that indicates that there could be something growing is a nipple discharge. A discharge from the nipple, it could be any colored, it could be colorless, straw colored, bloody, blood stained, it could be black, it could be green. So these are the signs that indicate that there's something happening in the breast. Often women who they're very busy today, these days, working all the time and busy at home with their children and their families, so they don't really get time, or they're not really mindful of their bodies, their health, and they don't get the time to sort of self examine. But a lot of them then complain, when they come to me, that they felt the breast suddenly feel heavy. So when you notice anything out of the ordinary, best to go get.
Okay. It's really a deep. You have given a great explanation about it. So this would really be helpful for women, because generally, as you said, women they'll be so involved in their family or their work that they forget about what is happening to themselves. Body shows various symptoms, but they don't mind it, or they forget about it.
Yes.
So my next question: what are the different types of treatments available for breast cancer?
So people should know that there are three main treatments for breast cancer. It includes surgery, there's chemotherapy, and there is radiation therapy. And certain patients, of course, with certain types of, say, hormone receptor positive breast cancers, they may require something called hormonal therapy once their treatment is over. So, who gets what? That really depends on the age of the patient, when have they presented to us, at what stage, what is the character of the tumor. There are receptor studies, there are biopsies that we have to do and find out what is the nature of the tumor. So the treatments will be decided based on that. Some patients may require surgery to be done first, followed by maybe chemotherapy if they require it, with or without radiation therapy. While some patients may require chemotherapy first, followed by surgery, and then, of course, radiation if it is required. Yeah, that's just the gist of the treatment. And then, of course, details will depend on the type of the tumor that the biopsy identifies and the character of the
Okay.
cancer.
Okay, so it depends varying to the person to person.
Yes, today breast cancer treatment is highly personalized. I always tell my patients this, that if you have 10 patients sitting in the clinic, Each of them may be getting a different sequence of treatment, different drugs, different kind of treatment entirely.
Okay, doctor. So I see many people once they have been diagnosed, they delay in undergoing the treatment. So they many of them they don't have the awareness that they should undergo the treatment immediately. So what? Why? How soon it is important for a person to undergo the treatment after the diagnosis?
Delays, just like early detection saves lives, right? So once the cancer is detected, you must get it treated as soon as possible. I have never advised a patient till date that yes, take your time. Yes, breast cancer is not an emergency, so which means that when the patient comes to me, I don't tell them, oh, this is an emergency, you have to get operated tomorrow. No, that's not the case, but one must start treatment immediately. uh, I would not advise delaying treatment, be it taking chemotherapy, be it surgery. Yes, of course, you can take a couple of days' time to discuss with your family, to decide what type of surgery do you want, etc. Discuss it with your doctor. Um, but that time that you take is for preparation for the treatment. But I would not advise anyone to sit on it for weeks or months, not at all.
Okay. So, my next question, what would be the process of the treatment? Initially, a person comes with a doubt, like they may have cancer. So, what would be the process after that?
Uh, So the first step, of course, is always a clinical examination where I would examine the patient, find out what their complaints are, and based on the complaints, based on my findings, we advise them tests. Right now, for someone with a suspected breast cancer, I'll just tell you the sequence of tests that are done. The first step would be breast image, where we need to see what's actually happening in the breast. So, more often than not, they are advised a mammogram. Along with a mammogram, an ultrasound correlation is always done. So, a mammogram is done, an ultrasound is done by the radiologist, and the findings from both the tests are correlated and they give us a set of information. Certain patients, maybe with some pathology in the duct, or with very dense breasts, we may advise them to do an MRI of the breast as well, in addition to these tests, right? So this is
Okay.
breast imaging. After the imaging is done, the next step is a biopsy, where you have to sample the tumor. Okay, so that's a biopsy is just a needle test. A lot of patients come to us telling us that, oh, they've done a fine needle aspiration cytology or an FNA. But in breast oncology, an FNA is not really recommended, because that's a very small, it's a thin needle, takes a very small amount of tissue. We always recommend a core needle biopsy, wherein a larger amount of tissue is taken out, which we can study and we get more information. So the
Okay.
biopsy will tell you what sort of lump is it. Is it a cancer or is it a benign lump? And in case it is a cancer, we get additional receptor studies done on that biopsy. So we look at typically ER, estrogen receptor, PR, progesterone receptor, HER2/neu, and some centers also look at something called a Ki67, which tells you the rate of growth of the cells, right? How fast or how slow or how aggressive is the tumor. And so once you have all this, we tend to stage the patient based on the clinical findings and the report. So the size of the tumor, are the axillary nodes involved? And if we think the axillary nodes may be involved, the lymph nodes in the underarm, then we may also advise them a biopsy of the axillary node to prove that it is involved by the cancer. And the next step, in most patients, we get something called a metastatic workup done. So that means that now a cancer has been diagnosed or identified. Is it restricted to the breast, or has it spread to any other organ? So, the tests recommended for this are generally whole body scans. So, we get CT scans of the entire body as well as a bone scan. To make it easier in the Indian setting, most people, more often than not, they advise a test called a PET CT. So once you
Okay.
do all these tests, you can stage the cancer and you can advise the patient as to what is the treatment that is recommended for them.
Okay, that was a very detailed explanation. Thank you. So, my next question, what is the difference between breast conservation and breast reconstruction surgery, and how it
So
would be beneficial for the women
breast
in terms of.
conservation
Yes,
is
yes.
where you save the breast. You don't remove the breast, right? Breast reconstruction is where the breast has been removed for whatever reason and you make a new breast. So that's the
Okay.
basic difference. And, you know, breast conservation, breast reconstruction is what all of us surgeons today we advocate. We're very pro these procedures because they help to retain the body image of an individual. Breasts are more than just an organ of to feed children. It also gives the woman her confidence. It does a lot to their psychosocial health. It contributes uh, to their psychological health as well. So it's very important that this is discussed with a woman as to whether she wants the breast removed or whether she would like to keep her breast, and we advise treatments accordingly. Even those for who require complete breast removal, options of breast reconstruction to recreate a new breast must be discussed with them.
Okay, doctor. So, is breast reconstruction surgery a good option, and for whom it is recommended?
Breast reconstruction is a very personal choice. It's definitely recommended for those who would like their breast reconstructed. There are various ways to reconstruct a breast. It really depends on uh, the patient at that point in time and their characteristics. Breast reconstruction, you can either use a woman's own body tissues to recreate the breast, typically the fat from the tummy area, or using the fat and the muscles from the back, the thighs, the buttocks, anywhere where there is adequate good amounts of fat that can be used to recreate the breast. Of course, there is another option of using silicone breast implants, which are internal breast implants, wherein we try and save the skin envelope and we place implants to reconstruct the breast. So it's a very detailed discussion. This discussion with patients is usually very detailed, where we tell them the various options, and what is suitable for that particular patient.
Okay. So, what are the different types of breast reconstruction options available? That it depends upon the person, right? As you've already said, or how it is. It
Yes,
depends.
it really depends on the person. Uh, the gold standard, of course, is using autologous tissue or a woman's own body tissues. So, where you use the tissue from her tummy area, that's called a DF flap, uh, inferior epigastric artery flap. It involves, how I explain this to patients is you're literally disconnecting the blood supply of that area. You take out the tissue, you bring it to the breast area, and you give it life again. You reinfuse it with life by connecting the blood vessels together. And we often pair up with plastic surgeons for this particular procedure.
Okay, doctor. So, in general, will lymph nodes that also be removed during the breast cancer surgery, or how it is?
Always. Lymph node management, we call it axillary staging, is a crucial part of breast cancer treatment. It is not therapeutic, as in it's not a cure, but it is done as a staging procedure. So what we do is, based on whether the woman has lymph nodes palpable and whether it's involved by cancer or not, we make our decision. So at the time of surgery, when we're operating on the breast, for those where you don't think the lymph nodes are involved by cancer, because from the various tests that you have done, we do something called a sentinel lymph node biopsy. So a sentinel lymph node biopsy is where a dye is injected around the nipple areola or around the lump before surgery, and on table we look at which is the first node that has taken up this dye, right? So, which is the guardian node, the sentinel node that has actually taken up the dye. We take out that node, it may be one or two in number, and we send it for something called frozen section testing. I mean, some centers have that facility. We have that facility where patient is on table and the nodes are checked by the pathologist as to whether it's involved by cancer or not. If it is not involved by cancer, you just let it be. You don't do anything more to the nodes. But if it is involved by cancer, you have to see how many nodes. Is it just one, or is it two, or is it three, a large number? Of course, if there is heavy nodal involvement, then we do not save the nodes. You have to clear the entire underarm area. So the nodes, the fat, everything from there has to be cleared in order to clear the disease.
Okay. So, what will the breast look like and feel for women after the surgery? What kind of feeling? Like many women, they lose their confidence in general. So, how they can regain their confidence and how it generally it looks like?
It depends, mainly on what kind of procedure is done,
Okay.
whether it's a breast conservation or a mastectomy or a breast reconstruction. And, the concept of a woman losing confidence during or after breast cancer treatment is something that we need to look at from the very beginning. So that starts from the first consultation itself, where you talk to them, try and gauge how they're doing mentally. And if you think this is going to affect them mentally and their confidence and their body image, we talk to them. We have detailed consultations. We refer them to our psychologist or our psychiatrist to discuss this further. In case someone has a lot of anxiety or depression, we start them on medications for the same, to build their confidence. We also, we've started a support group here at Apollo Proton Cancer Centre last week. So we actually encourage women to come and meet with other patients and talk to them, and, build to help build their confidence. So I would think a confidence is a separate entity from, the breast cancer surgery. Yes, what kind of procedure is done does contribute to the confidence in a certain way, but it is so much more than that. And what is the procedure that the woman must undergo is something that is decided keeping the disease characteristics in mind, and talking to the patient and her family as well as to what option suits her the best.
Okay. So now the next upcoming questions are the general questions from the cancer survivor,
Mhm.
generally what they have in their mind. So the first question is, will I go through the menopause as a result of the treatment? Will I be able to have children after the treatment? So these are, will I be able to breastfeed? So these are the common questions that a cancer survivor has. So what
Yes.
you would like to tell for that, doctor?
So, very relevant questions, first of all. Many a times, once cancer is diagnosed, discussion of this particular aspect just gets forgotten, because everyone's worried about, let's get rid of the cancer. And they don't really think about, the quality of life or the future or what they would like. So yes, certain cancer treatments like hormonal therapy, chemotherapy, it does affect the woman's fertility or her ability to conceive, because it may affect the ovaries, right? So this needs to be informed to the patient from the very beginning, especially someone who is of childbearing age, whose menstrual cycles have not stopped. Okay, because chemotherapy, it basically attacks any cell in the body that is rapidly growing. So that includes your hair follicles, that includes the ovarian cells. Okay, so when a woman is started on chemotherapy, it may affect her ovaries and the functioning will stop. So they do not go into menopause, but their periods will stop, but they still premenopausal. Very young women, of course, in their 20s or early 30s, whose ovarian function stops, it may resume a few years after treatment. But women who are slightly older, maybe 35, 36, their cycles may not resume. So the things that they can do, especially someone who's very keen on childbearing, you must have this discussion with your doctor. It would be best to see also a fertility specialist and to talk about, does she want to preserve her eggs? or in case she has a partner, would they like to preserve the embryo, right? The other option, of course, that we need to discuss with them as oncologists is in somebody who doesn't want to go into all that, egg and ovarian preservation. Would you like, if you would like the ovaries to be preserved, we can give a drug just before the chemotherapy, an injection that will protect the ovaries. So that's called ovarian suppression.
Okay.
So these are the few options that they have, and they must discuss it with their oncologist.
Okay, so the discussion will bring more awareness to them, and they can choose the
Yes,
options depending upon that.
yes,
Yeah,
I'm so glad you brought out this question.
definitely. Thank you. So, what are the chances? Generally, survivor they feel so much fear about the reoccurrence. So, what are the chances, especially when it comes to breast cancer, for the chances of reoccurrence here?
People should always understand that cancer is something that can always come back, even if the breast is removed. A lot of them are under the impression that, okay, doctor, why don't you take off the breast so the cancer will not come back? That is not the fact at all, which is why breast conservation concept has actually come to the fore. Now, when will a cancer recur? Again, it depends entirely on the behavior of the cancer, how aggressive it is. Certain subtypes like triple negative or HER2 positive types, which are slightly aggressive, they can come back within the first 3 to 5 years of treatment. Whereas some patients may be absolutely fine for like 10 years, and certain types of tumors, like hormone receptor positive tumors, they may have a tendency for the disease to come back after 10 years or so. But what they must understand, it's important to catch the disease early. So even if it comes back, it can be treated once again. There are so many patients who've undergone breast cancer treatments, twice or even three times. So all hope is not lost. But what is important is they must be aware. So, how does one do this? Generally, when patients complete their treatment, we don't just say goodbye to them. We call them every 3 months on follow ups where they come and see us, and we clinically examine them. If required, we do some tests to ensure that they are free from cancer.
That's that really explains because follow up is very important. Like many of them, no, after the treatment, they think it's, as you said, everything is over, and they don't go to the follow up, which is very bad actually. As
Yes.
you said, clearly mentions very very important for the follow up. So that my next question, doctor, after treatment, will a survivor be able to lead a normal life, and what diet they have to take? That is the question they have.
Yes, of course. Not just after treatment. I would say that even during treatment, I always encourage them to lead their normal lives. Someone who's working, their first concern is, oh no, now I have to quit my job. Not at all. It's important to have this conversation with your employer, and wherein you can get the liberty of taking leaves for certain days when you have to take your chemotherapy or something. But otherwise, I would encourage them to continue about their regular lifestyles, because that will keep them busy rather than thinking about the various side effects of the treatment. But that being said, even after treatment they can go about their regular lifestyles. There are certain precautions that they must take. For example, I completely disallow smoking. I do not encourage patients to smoke at all, because we have data to show that that encourages the growth of cancer and it increases the chance of recurrence of the disease coming back. Similarly, intake of alcohol, heavy alcohol intake or regular alcohol intake is not advised at all. I would encourage them to take in a healthy diet, one with which is rich in fiber, whole grains, less of processed foods, salted meats, and the like, and to just less of smoked food. So just lead a very healthy and a very active lifestyle to prevent it from coming back. Certain patients who've undergone surgery, they may have certain restrictions, regarding their arm movements and things like that. We always encourage them to exercise and tell them what they can and cannot do.
Okay, doctor, thank you. My next question is genetic test required for the cancer? After the cancer, breast cancer, their family, like the kids or the grandchildren, should they go to the through this genetic test in order to be cautious about the breast cancer and everything?
Okay. So first of all, I would like to inform you that only 10% of the cancers, breast cancers, are actually attributed to genetic causes or, family history, because of inheritance of certain genetic mutations. We do not advise all patients to do genetic testing. We advise those who are very young, maybe less than the age of 40, those with positive family histories where one or two first degree relatives or more than two second degree relatives, etc., suffer from not just that cancer but other cancers as well, suggesting a cancer syndrome because of a certain mutation. We also advise genetic testing to women with certain kinds of breast cancer. For example, women with triple negative breast cancer less than the age of 60. All of them, we advise them to do a genetic testing. Now, how would it help? Two things. First of all is it helps in treatment, because in case when you do the genetic test, a patient is found to have an inherited genetic mutation like BRCA1 or BRCA2. Today we have data to suggest that such patients may benefit from the addition of another drug called olaparib in their treatment regimen. Secondly, carrying a known genetic mutation has some implications on the surgery as well. Would you like us to conserve the breast or would you like us to remove the breast? What about the opposite breast? And how about, for example, certain patients with, say, BRCA1, BRCA2 mutations, they are also prone to ovarian cancers. So would you like us to remove the ovaries and uterus at the same time? So these are discussions that we need to have. But that being said, what is the implication on the relatives, right? So that is the secondary thing. We do not advise all the patients' relatives to go and get genetic testing done. No. It's very easy to do a genetic test. It's a simple blood test, really. But what is important is they meet a genetic counselor and they have that discussion with the counselor as to what is their risk of developing cancer. If it's more than, say, 15 or 20% or 30%, then we do recommend that they do a genetic test. But those going ahead with a genetic test, they must be aware of what they want to do if the test comes positive, right? If it comes negative, great. But if it comes positive, what are you going to do? Do you want to do prophylactic surgery? Do you want to take a preventive medication? Or do you just want to follow up? So these are discussions that must be had prior, and only then, once you're fully informed, they have to go ahead with a genetic test.
That's a very detailed explanation, doctor. I mean, many of them have these doubts, like what to do when it is running in genes. Not sure they when it is running in family. So this
Yeah.
clearly explains that. So, what are some of the ways the breast cancer can be prevented? As you already said, is healthy lifestyle plays a major role, and how important for women to breastfeed?
Prevention of breast cancer, breast cancer is said to be mainly driven by the hormone estrogen. Okay. So, any conditions that can increase the estrogen content in the body or exposure to estrogen can cause breast cancer. Now, there are modifiable causes and non modifiable causes. Non modifiable causes are women getting their menses very early and menopause at a very late stage. Certain women with, say, family histories or with known genetic inherited mutations. Some patients would have received radiation to the chest wall for maybe another cancer like a Hodgkin's lymphoma. So they are also at a risk for getting breast cancer. Now, these patients can't really do anything about the risk, right? They just have to do screening and things like that. But there is that group of patients who can alter their risk. Like, for example, breast cancer, the risk of breast cancer is supposed to increase in those women who have not had a baby or who've had children after the age of 30. The reasoning behind this is very simple. Pregnancy gives you a break from exposure to estrogen hormone. So those who've not had that break because of pregnancy or breastfeeding, their risk of getting cancer increases, but it's not 100%. It does not mandate that they will definitely suffer from breast cancer. The other things that one can do to reduce their risk is very general, something that all of us need to do. Lead a very healthy lifestyle. No smoking, reduce or limited alcohol intake, a healthy diet, one which is again rich in whole grains and cereals and fruits and vegetables, and proteins, and less in uh, processed foods. Reduce obesity, maintain your weight. We all must, be active and run and walk in order to reduce our risk to contract breast cancer. These are the things that we need to do. And I also think that, we need to head towards leading a more sustainable life, reduce our usage of plastics and things like that, because we don't really understand the impact that it may have. There are many articles coming up about microplastics being found in breast milk and in blood, and articles about BPA, that exposure of the body to BPA, and we all have it in our body, which is probably altering the hormonal balance, increasing the estrogen levels in our body, maybe giving rise to an increased risk of cancer. So we need to be mindful of the direction in which our lifestyle is headed.
It's a really wonderful awareness, doctor, because usage of plastic is something which is not being stressed upon, or which is not being understood. Still, there are many, like many of us, when we go outside, we buy water bottles and we drink it, but it has
Yes.
harmful effects. Yeah. So these are the questions that I wanted to cover, and I'm so happy that you have given so much awareness today, Doctor. I don't know how many of them you have helped today. So it's really great to have you in a talk show. And in spite of your busy schedule and everything, you have detailedly explained each and every question. So thank you so much once again, Doctor, for being here, and looking forward to interact with you once again. Thank you. Thank you so
Thank you,
much.
Ashwini. Entirely my pleasure. Thank you.
Thank you. Thank you, Doctor.